Very good morning. India today recorded 45,059 new COVID cases, 511 deaths in the last 24 hours. The total number of tests conducted in the same period was 8,49,596, which means the positivity rate was 5.1%. India has witnessed an unrelenting growth in the number of cases of COVID-19 since the pandemic began. Now, it's important to remember the size and the diversity of India, which complicates our COVID response. Many Indian states are the size of an entire European country in terms of population, and testing in this context is the single most important thing to measure, because everything else that we measure depends upon how we test. Testing dictates the numbers that we see daily that we've been reporting. It impacts public health decisions, which are based on the number of people that are showing up as positive, and that in turn depends on the amount of testing, without which we cannot realize the true scale of the pandemic, and it becomes next to impossible to predict the next steps that the government needs to take in order to contain the virus. As lockdown restrictions were lifted, testing assumed a greater role in infection control, and that is what we're going to dive into today on this episode of FYI. I'm Rupi Thingra. Let's get started. First things first, let's look at the types of tests that are available in the market. While there are different kinds of tests, we're going to be focusing on the main ones that are being used by the government and by private labs. The first one that we're going to look at is the molecular test. It's also known as the RT-PCR test. This test is, what it does is that it detects the presence of even tiny quantities of the virus's RNA, which is the genetic material of the virus, and the process that this test uses, it amplifies that small quantity into larger detectable quantities. The sample is then collected in the form of a nasal or throat swab, but the process takes time to give results. It could take 2 to 3 days to get the result back. Health authorities consider this to be the gold standard of frontline testing for the novel coronavirus, because this test is considered to be the most accurate one till date. So once it detects a sample to be positive, that means that this person is indeed infected. It costs around 2,000 to 3,000 rupees. The second test that we're going to now talk about is the rapid antigen test. So just for a bit of background, an antigen refers to a molecule. It could be a virus, a bacteria, or a fungus. So a molecule of that germ, any foreign matter or a germ that triggers an immune response, which basically is a reaction in our body when it recognizes and defends itself against a substance that appears foreign or harmful. And in the case of COVID, the antigen is the spike protein of the virus called SARS-CoV-2. In the antigen test, it helps us to identify whether this spike protein is present in the person or not. And as the name suggests, the rapid antigen test is a rapid diagnostic test that gives results faster than the RT-PCR. The sample is collected in a similar manner. A nasal swab or a throat swab is taken. The good news is that it tells you within a span of 5 to 10 minutes whether someone is infected or not. And the good thing is that it's much cheaper than the RT-PCR test. This one is priced around 500 rupees. But the drawback of this particular test in this case is that they have a higher chance of missing out on detecting the virus. So that is the reason why another test is needed. And some of you might have taken that test. Now, another test that's coming in the market is the Feluda paper strip test, which uses the CRISPR gene editing technology developed by the Council of Scientific and Industrial Research and CSIR IGIB. It's approved by the Drug Controller General of India, and it's expected to cost around 500 to 600 rupees. This is going to give a result in around 45 minutes. Now, before we get more details from our reporters on the ground and experts who are going to join us later, a quick explainer on what some of these terms mean. The government has been counting positivity rate on a daily basis. What does this mean? The daily positivity rate indicates the proportion of people that tested positive out of the total number of people that were tested on that particular day. The other terms that you might be hearing a lot are false positives and false negatives. Now, remember, no test is 100% accurate. There will always be some people who test positive and they do not have the disease, or negative. So a false positive means that the result has come out as positive, but you actually don't have COVID. A false negative means that you actually have COVID, but it failed to do so. So it was a false negative. So I hope this helps our viewers to understand more about testing for COVID. But let's get you an update from the ground. The centre has been calling for aggressive testing for COVID in the NCR region. Remember, Delhi and the NCR region has been showing a continued surge in the number of daily cases that they're reporting. Neeta, the Home Ministry yesterday said that in Delhi and the NCR region, for the first time, the number of RT-PCR tests exceeded the number of antigen tests. And we've heard over a period of time of why, testing needs to be ramped up, and the kind of test that you're conducting on people also needs to be changed from the, you should be doing more RT-PCR tests and less antigen tests. So what is the latest on that?
Yes, Ruby, as far as the sanctity of the tests are concerned, the doctors have been saying that RT-PCR gives you a little bit more of a correct picture. And that is why Arvind Kejriwal was of the viewpoint that, more RT-PCR tests should be done. But how can you increase RT-PCR tests? You need to, increase your testing capacity also. You need to increase your labs also, all infrastructure everywhere, in terms of doctors, in terms of technicians, in terms of machinery. So that's when, last Sunday, when the Union Home Minister, Mr. Amit Shah, took the meeting, he took a review in which it was stressed, that Delhi needs to, prep up its number, not only Delhi, but even the NCR region. That is why ICMR ensured them that from now on, the testing would be more as far as Delhi and NCR region is concerned. Mind you, Ruby, because in Delhi itself, the positivity rate is about 13%. As compared to the national average, it's 3 times more, because the national average as on today, though it is 5%, otherwise it was just roaming around 3 to 4%. So the positivity rate at Delhi is like really high. That is why the need for RT-PCR test was, felt here in Delhi and NCR region. ICMR has also ensured that, further they are going to enhance the testing capacities. Yesterday, Delhi tested about, on Saturday, in fact, Delhi tested about 52,000 tests. And the Home Ministry is now saying the RT-PCR tests were more as compared to the RAT test, that is the rapid antigen test. Even in terms of labs, they have been increased. Mobile testing vans, 10 number of mobile testing vans would be brought to your neighborhood so that people can just go and get themselves tested. The mobile testing vans would also have a capacity of about 20,000. Labs have been increased. AIMS is already, 6 labs have started functioning. As far as the equipment is concerned, Delhi has been getting, equipment from, as far as, BEL, Bhartiya Electrical Limited, has, given about 215 ventilators which have been installed in the DRDO hospital. Ruby?
Right, well, thank you very much, Neeta, for those details. In fact, we're talking about the Delhi NCR region. Let's go over to our correspondent Arun, who has the latest. He's been tracking the door-to-door survey that has been taking place in the national capital. Arun, the centre has called for aggressive testing. And if you remember, seroprevalence studies that have been done have already shown that more people had COVID than earlier thought of. And now there was this sero survey, this 5-day exercise that was going on. What's the latest that you can tell us?
Well, this is a survey the Delhi government has ordered to conduct in over 4,500 containment zones. Now, this will cover a huge population of the national capital. This is a 5-day exercise that started on Friday and will be ending tomorrow. Now, Delhi government has assigned this work to ASHA workers, civil defense officials, and also some teaching staff as well. Now, it is a very simple exercise. They go to every single house in the containment zone, ask if somebody is symptomatic. On finding a symptomatic person, they conduct a rapid antigen test on them, and they also have a COVID testing van along with them. And if you talk about commercial areas, they carry a van which also has a facility of RT-PCR test, and they are asking every single person of the market, as in every single shopkeeper of the market, to get tested as they interact with at least 10 to 15 people every single day. So that's the exercise which is being conducted by Delhi government. Now, this is door-to-door survey for which various officials and volunteers are being used, and this is being done in over 4,500 containment zone, Ruby.
Right. Thank you very much, Arun, for those details. And now we're joined by a panel of experts to tell us what all this information means. We have Dr. Ravinder K. Dhameja, who's a WHO Fellow, National Institute of Epidemiology, Head of Neurology Department of Lady Hardinge Medical College. We also have Dr. Rajesh Parekh, the Director of Medical Research, Jaslok Hospital, and we have the additional DGHS of India. We're meeting. We're going to start by asking Dr. Ravinder Dhameja. Sir, the question that many people ask, many lay people ask, that why are two tests required? You know, if you're already doing an antigen test, why an RT-PCR test? Why not just do an RT-PCR test? Can you shed some light on that?
Thank you very much for having me in your program. I think the testing is the single most important tool. It's actually our window into the pandemic and how it is spreading. Without testing, we have no way of understanding the epidemic. Now, there are different types of tests available, as you mentioned, about the gold standard RT-PCR, the rapid antigen test, and the antibody test. And rapid antigen tests also have been, developed. The other way of getting it rapid, like Faluda or the CRISPR technology, or one is called LAMP test, LAMP test. So these are all tests to find out actually the cases so that they can be, their contacts can be traced, and these people can be, isolated so that the spread is limited or contained or the chain is broken. But coming back to the two different kind of tests which you mentioned, the RT-PCR is the gold standard as of now because we have much more learned about this test, and this is being used for so many other diseases. However, the sensitivity is still 60 to 70%. That means we are still not 100% as for this test. The problem with this test is that it takes time. It takes sometimes it takes 24 hours. So by the time the results come in, the people who have been tested keep on spreading. So the time gap between the testing and the reports has to be shortened within hours. So that many countries now many labs are giving results in 6 to 8 hours. The more important thing is once you go for the testing, you should isolate yourself till the test reports come in. So that's one thing very important. Regarding number of tests, I would like to mention that there are so many things which you have mentioned.
I was actually just going to ask you, are you happy with the current levels of testing in the country?
Yes, that's what brings me into how we assess that we are testing enough or not. So there are two ways of doing this. One is at the positivity rate, which WHO says has to be less than 5% for at least for 2 weeks to know that the epidemic is or the pandemic is under control, and as well as the adequate number of testing. The Delhi is around 12% now. Of course, obviously we are not testing enough. The country is about 4 to 5%. That means we are in that range of WHO's definition or the benchmark. But I look at the other way around. I look at the number of tests you do to find out one confirmed case. So if, for example, if the Delhi is reporting 8,000 cases per day, so minimum number is 10 to 30 per case as per WHO. So that means you should be testing at least 80,000 to 2,40,000, somewhere in between, average maybe around 1 lakh.
You're saying that we should be conducting that many tests on a daily basis?
Yes, exactly. So that if these are the daily number of cases, so Delhi has reporting 7 to 8,000 daily new cases. These are the new number of cases reported every day. So the WHO says that we need to have at least 10 to 30 tests per confirmed case on a daily to daily basis. So if the 8,000 tests are there, we need to have at least 80,000 to 1,40,000. So that's the range. So if you take in between at least, let
me take that to Dr. Rakesh Verma, the Additional Director General of Health Services of the Government of India. Sir, Dr. Dhameja here saying that we should indeed be testing more. Are you happy with the current testing levels? You know, the government earlier in November said that we're the second highest in terms of testing in the world. But is that enough?
See, Ruby, your question is very pertinent and very relevant. You must realize this is a pandemic which was never known before. And we all thought that it will last for a couple of weeks or months, but it would last for years. Nobody was expecting. We were already fighting with other diseases, but the Government of India at the highest level has taken all the steps possible which are required to combat and fight with this pandemic of COVID-19. At every level in the government, everybody is geared up, fully tuned.
So we understand that everybody is fighting the disease, but specifically about testing, are you happy with the testing levels in the country, sir?
see, especially about coming to testing also, I must tell you, all the state governments, district governments and central government is trying to increase the number of testing by day. Every day, like yesterday, more than 50,000 tests have been done in Delhi alone, which has got a population of floating population of between 1.5 to 2 crores. So, and you can't increase the test in one day. It's not like a bulb which can be switched on.
But sir, it hasn't been one day since we found out about the pandemic.
So
it's been many months.
See, the government of India has increased the number of medical colleges, paramedics, and the pumped in even doctors from paramedic staff, from paramilitary, CRPF, PSF, they're all doctors and paramedics have been brought down to Delhi so that no person is denied a test, no person has to walk long distance for test. The tests are being done almost at the doorsteps, and it will be increased further. I can assure you, as I mentioned in the last talk, the Honorable Health Minister of India has got a war room only for examining all these problems, all these challenges, and giving a solution to that.
Okay, so let me take that to Dr. Rajesh Parekh, who also joins us from Mumbai. He's the co-author of a book called The Coronavirus, What You Need to Know About the Global Pandemic. Welcome, sir, on the show. You've heard both the gentlemen on the issue of COVID testing. Are you happy with the amount of testing that has been taking place in the country? You know, today the reports indicate that the positivity rate overall is 5.1%. What does this mean? Can you tell our viewers?
Okay, so Ruby, first of all, let me begin by congratulating you on two things. One, that you're devoting an entire program to testing. This is perhaps the single most important thing to discuss, as you have pointed out. And second, at the comprehensive coverage that you have given on all these tests. There are a couple of things I need to clarify on your coverage, but I'll come to that as soon as I've answered your specific question about the number of tests that are being conducted. First of all, I agree with whatever Dr. Verma and Dr. Tameja are saying. Quite clearly, everybody is trying very hard to contain this. But, you know, Ruby, in this pandemic, there are no effort prizes. The only indicator is the number of deaths, the number of cases. And the number of cases is predicated, unfortunately, on the number of tests that are done and the quality of tests that are done. Now, there are various ways at looking at how well we are doing with the testing, on which depends on how happy we should be. But there's one very simple measure, and that is how many tests per million, not the total number of tests being done per day, because mind you, we are a huge country, so the number of tests is going to be high. So when we say we are the second highest in the number of tests being done per day, that really doesn't tell us much. There are actually 25 countries ahead of us in terms of the number of tests being done per million.
Right.
The one number we need to keep in mind, and your channel has alluded to it time and again, is that we're doing 95,000 tests per million today. So I'm very happy with that. It's
right. Dr. Parekh, I'm going to ask you to hold that thought. I need to take a quick break. And on the other side, we're going to get into the more details of that.
Sure.
Welcome back. We're discussing the very important issue of COVID testing on FIR. Let's bring up our guests. Let's go back to Dr. Rajesh Parekh, who's talking about the kind of tests that are taking place in the country and are we testing enough? Dr. Parekh.
Yes. So let me begin, first of all, very quickly, Ruby, by talking about the book that you alluded to, the book on the coronavirus, which we wrote in the month of March. And in that book, we emphasize the need for increased testing.
Right.
In fact, long before we had a single death in this country, there were just about 84 cases, to be precise, in India, and no deaths. I emphasized the need to step up our testing to the level, or almost to the level that South Korea was doing. Second thing, we have clear examples before us. We don't need to reinvent the wheel. On the 15th of January, the first cases were reported both in South Korea and the United States. The first country stepped up its testing. The second country not only did not test enough, but in fact the president was denying that there was a problem on hand.
Dr. Parekh, I'd like to interrupt you with specifically talking about COVID testing in the Indian context and why, sero surveys have showed that, there has been more infections in the country than we are getting to know only from testing. So just to simplify what all of these terms mean for the viewers, if you can just, explain that bit.
Absolutely, I'll do that. But the reason I was alluding to the United States and South Korea is because there are reference points, examples for us to look at. As far as the terms are concerned, the nomenclature is concerned, first of all, you had a comprehensive report on all the tests. Let me just add one more, which is now going to become very important. The health minister himself has said that that's the test we are going to start using, and that is RT-LAMP. It combines the advantages both of RT-PCR, which is accuracy, specificity, high specificity, and of the antigen test, which is rapidity of response. So that is a third category of tests, and we're going to hear a lot more about it. Once again, we wrote about RT-LAMP tests and urged for it as way back as March, but that's happening. In terms of nomenclature, very simple. Specificity is, you talked about the false positive rate. Specificity means how low the false positives are. RT-PCR gives us about 98%, as Dr. Dhamija told us already. The sensitivity of most of these tests is not that high. They're about 70, 75%. So these are the challenges we're dealing with. We do need to repeat tests, particularly if they are negative, because, a false negative test has far more sinister implications than a false positive test.
Right. So, I'd like to take that to Dr. Dhamija. Sir, a lot of people have written in and tweeted us, asking about how many times does a person need to get tested? People have very basic questions about COVID testing, right? And yes, there are various factors that, they impact whether a test will be positive or negative, the storage of the sample, the timing of sample collection, the transportation, all of these things affect whether a test result would come out as damaged, as negative or positive, right? So just explain to our viewers of what this means. Another question that people are asking is that there, you've seen random testing that is taking place now at the Delhi-Gurgaon border, at the Delhi-Noida border. Is that going to help contain the spread?
Ruby, I just lost the sound, but if I understood correctly, you meant that what should be the timing of the testing and whether the rapid antigen tests are going to help us?
The first question is, how often should one person keep getting tested? If I've tested negative once, should I keep getting tested every month maybe to find that out? If
so
maybe I'm asymptomatic. And the second question is about random testing at borders.
That also reflects these numbers, whether they are...
Dr. Dhamija, go ahead.
So the first question is that whether if the person is tested negative, how frequently he should... Yeah, can you hear me?
Yes, sir, go ahead, please.
Am I audible?
Yes, please, sir, go ahead.
Okay. So the first question regarding the negative person who is COVID negative, how frequently should he be getting tests? So this COVID testing, whether it is PCR or a rapid antigen test, is one point of time testing. That tells you whether today you are infected or you are not infected. So if there's no point of saying that if you are negative, you are safe, or something like that has happened, that you have been tested negative. So it is all exposure, it's all your susceptibility, it's all your, the chances of acquiring infection, whether you are working in a high risk environment, or you are working at home, or you are working in office and you have not been exposed. So there should not be panic testing around. So that's one thing, that if you are exposed, if you have symptoms and you are in the timeline of that natural history of the disease, you should be getting tested. And the best timing is between 3rd to 5th day, when the viral load is maximum. Now,
okay, Dr. Dhamija, I have time for one last question which I'd like to ask Dr. Rakesh Verma. Sir, what do you plan to achieve by this random testing that is taking place at the borders of Delhi and Gurgaon?
Yeah,
quick answer, sir.
That is because of migration of patient from A state to B state. Dr. Dhamija, please continue.
So I was just telling that rapid antigen test is very, very effective when you have a high number of cases like in containment area, or it is a point of test whether you are doing a elective surgery or you are doing an emergency surgery.
Right.
So that gives you instant result, but then false negative test. For example, if the Noida is testing 9 out of 179, that means there are about 10% or 5% people are still asymptomatic which are roaming around. So it is important. It is very important, and it should be done. In fact, many countries have now open testing policy that you can walk in and you can get in from the mobile vans.
Okay, well, thank you very much,
test has
gentlemen,
its
for
own
joining
importance.
us on our special episode on COVID testing.
Ruby, through your channel, I really want to re-emphasize once again, please, the best vaccine is wearing a mask always. Second is maintain a social distancing, socio-medical distancing of 6 to 8 feet. And kindly do not get out of your homes unless it is mandatory. Do not feel shy of using a mask whenever you are in public, when you are making a stranger, except when you are alone. If you know a colleague also, please wear a mask. If there are 2% in the office, 3% in the office, do not hesitate to use a mask. It is the best vaccine as of today.
Right,
Clean your hands and maintain distancing.
Thank you very much.
My best wishes again.
Thank you very much, doctors, for joining us on our very special show on COVID testing. I hope that this explained a lot of the terminologies and the importance of testing and wearing a mask, as Dr. Varma was saying. Thank you for watching FIR.